Hi Veronica, based off of your scenario of a 27-year-old pregnant female with complaints of chronic fatigue, shortness of breath, and dizziness, with pale skin, appears to be frail, and admits to cravings of ice chips, I would assume that without any labs to go off of, that she would be experiencing iron deficiency anemia. Based off of this assumption, I would make sure to order a complete blood count, as I'd be looking for low hemoglobin and low hematocrit levels. I would also assume that the MCV and the MCHC are low as well. I would proceed to order ferritin levels, assuming that these would result in a low level, as well as a transferrin saturation. The only lab work that I would assume to come back as elevated is a transferrin. The reason that the transferrin should come back elevated is due to the body trying to compensate for the low iron levels by increasing transport. Once these labs have resulted and the diagnosis that I expected was confirmed, I would then explain to the 27-year-old that the absorption in iron in her case is very important and she should take in a daily prenatal vitamin. I would also recommend increased iron-rich foods in her diet, such as leafy green vegetables, liver, fish, beans, raisins, and red meats. Due to her being pregnant, though, I would also make sure to reiterate the importance of fully cooking the red meat and the fish. Lastly, I would also recommend adding in a vitamin C supplement, as vitamin C helps increase the absorption of iron. I would plan to recheck labs at her next check-in visit, and if the levels are still abnormal and she's still asymptomatic, then I would plan to prescribe a daily iron supplement for her. I would make sure that this patient is aware of the increased risk of iron deficiency anemia during pregnancy, just because your body typically needs to have more types of iron within your levels as you are pregnant and as your baby needs to grow as well. I would also explain that not only is she going to not feel the best, but it's also a great risk factor for prematurity in infants as well. So we need to make sure that she is aware of how important it is to start focusing on taking in new iron supplements, making sure that she's taking her prenatals daily, and she needs to make sure that she's starting to increase her diet with iron-rich foods.